everybody have
yours
this
is right
fruit
there.
fly. They're a pain. I know. They came in quick. I know, they just appear, don't they? I don't understand that, the fruit fly thing.
Yeah.
Right?
They're just
1 minute
there.
they're, 1 minute they're there, 1 minute they're not.
Mostly in the humid weather, I've noticed.
Yeah.
And then get in through the little bittiest hole.
Yeah, I know.
Little bittiest one.
Something. So I think, should we just go ahead and begin? Do you think this is who's going to be here today? Today I thought we would talk about adult immunizations. So you have a handout there that we'll be referring to, especially because it's coming into the time of year when we're all thinking about maybe flu shots and pneumonia shots and all those kind of things. I thought it would be a good idea to just recap what's recommended for adults and particularly seniors for getting vaccinated. So sometimes we think of all the kiddos getting shots, but we also need some vaccinations too to be healthy. So you can see that your top 10 reasons to vaccinate here. You might be at risk for some serious diseases, and a lot of them are prevented by vaccines. I was just watching the news the other day, and they were talking about how some people now are more hesitant to vaccinate, their children because they're actually not seeing polio anymore and things like that. But you all know that was generation. You saw people sick with polio, and the diseases aren't out there because people have been vaccinated. So we don't want anyone being at risk for any of those diseases. Sometimes certain complications of those illnesses can really keep you down, and we don't want anyone getting hospitalized if they don't have to be. When you get vaccinated, you reduce not only the risk for yourself from becoming ill, but also protecting other people around you from becoming ill, especially those people that for some reason may not be able to get immunized and get that vaccine. Maybe they're allergic to it, or maybe it's a live vaccine and they have an immune system that does not allow them to be able to get that vaccination. So when you get vaccinated, you're not only protecting yourself, but you're also protecting those people around you from getting sick. So that's another good reason. Who has time to get sick anyway? I like number 5. You don't have time to get sick. It really does. It can, especially as we get older and our bodies don't bounce back like they maybe once used to, it can take longer to recover from something like the flu or pneumonia or something like that. You don't want to miss what's important to you. Spending time with your family and friends, taking out time for your hobbies. We want to be able to maintain our lifestyle. You don't want to pay the price of getting sick. Some of them, a lot of times, those hospitalizations or the follow-up or rehabilitation or additional medications that you might need can get costly. So, of course, we're all looking at our fixed incomes and saving our money if we can. Traveling. There's certain vaccinations that I'm not really going to talk about today, but if you were to travel, certain vaccinations are required, especially for out-of-the-country travel. And I always tell people it's important to think about that ahead of time. If you're traveling next week, there's a lot of vaccinations that actually are a series of 1 or 2, and they take a couple of months. So if you are traveling out of the country, or if you know people that are, it's a good idea for them to check and see if they might need additional immunizations. And then who wants to feel sick anyway? None of us want to feel sick. So preventing the illness, some of them are really serious with serious complications, but then you just don't want to feel bad anyway and feel sick. So that's and we have our little cute nurse there who's ready to give you a shot. That'll be us next month during flu season, ready to, and my nurse cap did not look like that, by the way. Mine was like the pillbox style, the little ribbon. So then if you flip your pages over into you all have a pen. So since I did this last time, I did this presentation, we'll do it again today. Grab your pens and turn to page 2. It looks like this, Vaccinations for Adults. And there's a list. You're on the right page right there. Everybody got it? You got it, bud. Looks like this. Yep. And then grab your pen and click the end so the pen's ready to work here for you. And let's circle the ones that we're going to talk about today, the ones that are most important for you. Go down to influenza. That's the 4th one. Just circle that one. And then you're going to go down a couple more to the pneumococcal, pneumococcal. And then the one after that, let's circle that one too. That one's tetanus, diphtheria, whooping cough, pertussis. And then I want you to circle, you can skip one and go down to zoster. In parentheses it says shingles. Circle that one. Those are the ones that we're going to talk about today. So of course, the first one on our list that we circled up at the top is influenza. Every year, it's recommended that we all ages, 6 months and older, but particularly adults and seniors, get vaccinated with their yearly seasonal influenza vaccine. And the reason why we get it every year is because they actually tweak the formula each year. And they base that on what strains of influenza virus were circulating in the communities the year before. And so that's how they kind of figure out, well, what are we going to make this vaccine protect against? So there's lots of different formulas for influenza vaccinations. It's a once-a-year shot in the arm, pretty much. There's other formulations. There has been in the past a mist that kids could get in the nose. That's not going to be available this year. There's some you might have heard of, the high-dose flu shot. Has anyone heard of that? Yeah, maybe last year there was commercials on TV. They were all dancing, I remember. So that one was a fairly new vaccination, influenza vaccination for those 65 and older. It's been out just for a couple of years now. Some doctors will recommend that for you. Otherwise, they feel like as you get older, your immunity might respond slower, so you might benefit from having an increased dose of that flu vaccine. And then there's actually a formulation that is called Intradermal, and that actually means that it was a little tiny needle, but it would go just right under the skin. Most flu shots, they're actually given into a muscle so that they can be absorbed. So that one is not as common as the other ones, but that is a formula that's out there. And you can get it at all different clinics now. We'll be holding, our Neshoba Board of Health, your town will be holding a clinic. Month of October is the big mad dash when we're out all over the place, so you can check our website is www.neshoba.org, and there'll be a whole listing of all the clinics anyone can attend, and they're open to all ages, 6 months, all up, no end there. You can come any age, and then you're welcome to get your flu shot. If you come to one of our clinics, bring your insurance card. We'll make a copy of that, and then it's a pretty easy process from there. But I do know people are getting them from their doctors, they're getting them from grocery stores, from pharmacies, so please, it is important to do that. And part of the reason is the next vaccination that we circled down the list is the pneumococcal. And I just want to take a moment to say that when you get your influenza vaccine, you're actually kind of protecting yourself 2 times. Because who knows what the #1 complication of influenza is?
Okay.
Anyone?
Oh, all right.
Pneumonia.
Yeah,
Right? So if you are getting the influenza vaccination, chances are you're reducing your risk to getting influenza, but you're also reducing your risk for even further developing pneumonia. So it's kind of a two for one there, or you're really helping yourself out. So that next one is the pneumococcal vaccine. So you must have heard by now that now there was a fairly recent recommendation. It came out last year. We all got the first pneumonia shot. Pneumococcal people know as the pneumonia shot. So everyone here probably has had that. Do you know anyone has had the pneumococcal shot? Yeah. So just last year, they recommended actually for adults over 60 to get an additional pneumococcal shot. It's not a new vaccine. That vaccine's been around for a long time. It's just newly recommended for that age group. And basically the thought behind it is it will give you an additional protection for a whole bunch of other strains of pneumococcal bacteria which can cause illness. So you get that one that we all got probably, and then they're also recommending you also get this additional one because it will give you more protection. The one that we all got before was the Pneumovax, and that protected against the top 23 bacterial strains of pneumococcal disease. But there's hundreds and hundreds out there. They just picked the most commonly seen illnesses. And then so if you haven't gotten that second pneumococcal shot, talk to your doctor about that. You may be due for that. And the thing about the pneumococcal shot, and I know most people know it as the pneumonia shot, But the pneumococcal, that's just the name for the bacteria. And so on my board here, I wanted you to know that it's not just protecting you against pneumonia. Pneumococcal bacteria can cause other types of illness. So certainly it could cause pneumonia, which typically people have fever, they don't feel well, may have flu-like symptoms, they may be coughing, they may find shortness of breath. But it can also protect against that middle one, meningitis. Does anyone know what meningitis is? It's anything that has itis at the end of it means inflammation of. And the meninges part, the meningitis part, it's a thin membrane that covers the brain and the spinal cord. And so the meningitis actually is an inflammation of that. And so this bacteria could also manifest itself in that way and cause that type of illness. So it's not just pneumonia, it could cause the meningitis. And then the bacteremia, which is actually like a blood infection. Same thing, you can get sick, very sick from that as well. So even though we call it the pneumonia shot, it's really protecting you against these other types of illnesses that this particular bacteria can cause in your body. So it's just important to know that. Any questions about that shot?
I have a few itises, osteoarthritis.
Arthritis?
And,
Bursitis?
yeah.
Yeah,
Arthritis.
so the itis,
And
like
that.
again, the arthritis, arth is the root word for joint. So that's where you get the inflammation of the joints.
Yeah.
And then the bursitis it's a bursa. It's like, usually it's a little fluid sac in your joints in that area. Yeah, and it hurts. That's it, it hurts. So, okay. So then we'll go on to the next one we circled was tetanus, diphtheria, whooping cough, and pertussis. And so you've heard that as your tetanus shot. So you see two, if you look in the parentheses under the bold face, it says Tdap, comma Td. So those are two different vaccines. The one we all think of that we've always gotten for tetanus is the Td. It actually has protection against diphtheria in it, but you probably don't even really think about that, right? You get that every 10 years. That's your regular booster of your tetanus shot. Unless you get cut by something metal, step on a nail, get a dog bite, then you go into the emergency room and get your tetanus booster, right? Well, they're recommending that for at least one of those routine tetanus booster shots, that you actually get a Tdap. And the DAP is the tetanus for the T, the D is for the diphtheria, and the A means acellular, it's just in the formulation. And the P is pertussis, and pertussis is the other word for, anyone know? Whooping cough, exactly right. The reason why the recommendation is that to get at least one of those, especially if you're around grandchildren or great-grandchildren, because of the babies. The babies can get very sick and they could actually die from whooping cough. So you're really protecting the small ones that can't get that vaccination yet. So that's why it is recommended that you get that booster once. And the final one on our list is zoster, which is shingles. Anyone here gotten their shingles vaccine? Nobody?
Got the shingles.
Oh, no. So that's the thing. What's that?
I've had the shingles.
Yeah. So shingles, I don't know, I'll give you a little recap about shingles, and you feel free to add in if you have questions. Shingles basically is the same as the chickenpox virus, right? Most all of us have had chickenpox. And so what happens is, once you have the chickenpox, you get sick, probably when you were a kid, and then you heal up and that's fine. Years later, that virus is still in your body, it's just sleeping, and it's not causing you to be ill, but it's still in there. And then so for whatever reason, doctors and researchers aren't completely 100% sure why, but it can come out later in your body and you can become ill with shingles. So it manifests itself very similarly to chickenpox in the fact that you have a rash, but usually there's more pain involved, flu-like symptoms, and then the difference between a chickenpox rash and a shingles rash is shingles, the little blisters or the rash, actually is typically on one side of the body. And the reason for that is because it's following a nerve branch. And so that's how we can usually distinguish what's a shingles versus chickenpox. And so it's important that you get treatment right away if you do think you might have shingles. And there's usually a couple of things that the doctors will do for you. They may put you on a medication that's an antiviral medication. They may sometimes, if it's a really bad case, put you on a steroid for inflammation, a swelling of the nerves. And sometimes they'll give you some specialty pain medications that are really more effective for dealing with nerve pain. So if the sooner you get to the doctor and checked out, the better chance you'll have of feeling better quicker and hopefully decreasing how long that you're sick. So the thing with the shingles shot is it's about 70–75% effective in preventing shingles. It's not to say you may not develop shingles if you've had the shot, but if you do, your chances of having it be as severe a case is much less. So by having the shingles shot, if you were to get sick with shingles, your illness wouldn't last as long and you probably wouldn't be as sick as if you hadn't received the vaccination. So it is important. Consider it. Do ask your insurance company. I'm pretty sure that Medicare now covers it, but I would double check on what plan you have because it is an expensive vaccine. Also, shingles is a little different because the zoster vaccine, it's a live virus vaccine. So that means it's a live virus. It has to be frozen. It has to be given right away. That's part of the reason for the expense of it is the handling. Also, some people, once they get it's a shot in the arm, sometimes they'll develop a few little blisters or a rash at the site, which is not a bad thing, but you don't want anyone coming into contact with those blisters. The same, you can't pass shingles from person to person. But if someone came in contact with those blisters, you could give someone who's never had chickenpox, they would develop chickenpox if they were exposed to those shingles vesicles. Any questions about that? Anyone? No? I think that's it then. So I did include on your sheet on the last page is actually, I get a lot of questions about medication and drug coverage, and my insurance may not cover that, or it's really expensive, what can I do? So I did put on the back page just a couple of resources that you may find helpful, not just for immunizations or vaccines, but for any of your medication questions. Certainly I would have the conversation with your doctor or whoever prescribed a medication or an injection that's too expensive, out-of-pocket expense to you or not covered like they thought. Go back to them and say, hey, that's too expensive, I can't afford it, what's the alternative? But then I also included the prescription advantage information because that may be helpful for you. And then the part on the right where it says MCPHS, that's actually the Massachusetts College of Pharmacy and Health Sciences. They actually have a free outreach program. You can call them, during normal business hours, and you can talk to a pharmacy or a pharmacy intern, and they will basically do a one-on-one consult. I'm sure, hopefully you have a good relationship with your pharmacist, and you can have those conversations and feel like they're giving you the time to actually ask your questions and get the answers that you need so that you're fully understanding what you're taking, how you're to take it, and when you're taking it, and for how long. That's really important. So don't forget to do that. Be sure you know what you're taking and why and how to take it. So the pharmacy team, the outreach program, is really good at coming up with other solutions or providing alternatives for things that may be really costly. So it's worth a call to them. They'll even interface with your doctor to save you from calling the doctor. They will offer to do that for you if you need that kind of advocacy and that kind of help. So I just wanted to let you know about those two resources if you haven't. Like I said, hopefully you have a good relationship with your pharmacist and you're comfortable with how your medications are being organized and thought out. But any more questions? Comments? No? Oh, you guys are quiet today. I think that... So tetanus, yeah. So tetanus is one of the ones on your page. It's the fourth one up from the bottom on the second sheet. That one can hurt a little bit more. You're only due for that every 10 years. It's just a booster unless you get cut or have an accident or a dog bite. Then you go get another booster. And it's recommended you get one at least that has the pertussis coverage in it as well. And that one. That shot is a thick serum, so sometimes people say that one hurts a little more.
Yeah, it does.
Yeah, yeah.
Yes.
Well, at least most shots are given in your arm these days. I have lots of veterans tell me they remember their Army, Navy, days when they'd walk down the line and they'd get shot with the immunization guns on both sides. Yeah. And then some of us have the smallpox vaccination scars on our arms. I was taught how to do that. It's a totally different technique from other vaccinations. Yeah, not so pleasant. But yeah, so I think that's it. Most people can get most of the vaccinations. There's not, with the flu shot, you have to be cautious with allergies to eggs. Some of the immunizations they have like a neomycin in it, and that's an antibiotic. Some of them have some preservative that some people have some sensitivities to. But for the most part, anytime you're going to get an injection, it's good for you to tell your provider or whoever's administering that to be sure, if you have any allergies or sensitivities, to let them know. Usually with the flu shot, I get asked a lot of times, can I get it if I'm still sick? And the short answer is yes, if you have a cold or a very mild illness. I always recommend, if you're having a fever or you're really not, I would maybe wait until you're feeling better. One, because it can bring out the signs and symptoms of your current illness. Two, your body's already working to kind of, fight something, and you want to give your immune system time to do that. It does take 2 weeks from the time you get your flu shot until you're actually protected from getting the flu. So if you're exposed to it in those 2 weeks, you could still get sick in theory. It takes a little while. It's not an instant protection. And if you've actually, going back to the shingles, if you've actually had the shingles illness, you've got some natural immunity, now because you've had the illness. So, but your doctor still may recommend after a couple years to get it. Depends,
She's good.
Good.
Oh, yeah.
Good. I'm glad you have a good rapport.
Yes, I do.
Very good.
Yes.
All right. I think that does it. Any other questions? What do you guys want to talk about next time? I can go all day. I can pick all kinds of different topics. I just want it to be interesting for you, So if you think of things, please let the team here know, Allison and Suzanne and, Sharon, we'll all talk about whatever's interesting or, upsetting to you. Next month, I won't be doing a talk. I'll be busy doing all kinds of flu clinics. But there will be the volunteer nurse, Sue, is going to be doing the blood pressure clinic, so she'll be here. And then I will catch you all, hopefully in November, maybe at the new building. Yeah, that'll be exciting. So,
Can't wait.
yeah. All right. Thank you all.
Thank
All
you
right.
very much.
You're welcome. Oh. Not sure if I need to.
No, but I can make copies. Do you have any more hands?
I do.
Oh, she does.
Wasn't sure if I needed to touch anything there.